for hours. And by repeating the treatment on a day-to-day basis, what you do then is you gradually reach a level of plateauing of the benefit. And that serves then to serve as a new platform, a new level of functioning in the body that helps you to actually become resistant to further damage by external stimuli that may have caused problems in the body in the first place. We have thermograms that show significant improvement in circulation. We even have a study that was done using an aurimeter where they found a significant improvement in the energy levels seen on the aurimeter. So magnetic fields are probably affecting the general biofields of the body, which are now coming under some study by physicists and other people using instrumentation that is not normally available to doctors. Leg ulcers and wounds have healed significantly. We have had people who have been on the brink of gangrene from diabetes and peripheral vascular disease, and we have seen significant improvements in those individuals. We have seen the use of magnetic fields in wounds, post-operative wounds, say people who have scars from surgery, from hysterectomies, or from gallbladder surgery where the scar breaks down. Magnetic fields help that scar to heal very rapidly. I think with that, I won't go into other rules of use and contraindications and precautions. That hopefully will come out in the further discussion that we have and the questions. What I want to do is tell everybody that as I take questions, even though your questions may be personal to you, what I do, this is not a personal consultation. This is not time for a personal consultation. What I do is take the information in the question and try to expand on the answer to the question for everybody to benefit by it. We have a number of clinicians, lots of clinical people, doctors, chiropractors, podiatrists, massage therapists, all sorts of clinical people on these lines listening to this call, and they all benefit by hearing about how you might consider working through a particular person's problem that might be presented to them. And so with that, Christina, I think I'm ready to take questions.
Okay. QuantronResonanceSystems.com.
Pollock?
Yes.
This is Dr. Steve Haltwanger.
Nice to have you on the line again.
Listen, as you were talking, it sounded to me like one of the effects was like a biological effect similar to that of magnesium. It's like an electrical magnesium effect, stimulating metabolism by ATP. Magnesium is ATP cofactor of the enzymes. Vasodilation is a magnesium effect. And magnesium also increases protein synthesis of nucleic acid. Is it possible that if you used magnesium with this, you would have an enhancement of the effect?
I have not seen any studies with that. It would be worth taking a look at. One of the things we know about the magnetic fields is they increase nitric oxide. Nitric oxide causes changes in calcium flows. We used to think that all of the effects were modulated or mediated through calcium, but that's really not true. And so nitric oxide has actions that act on calcium to a great extent. Where there's calcium changes or calcium flows, you will have changes in magnesium. So, is it the magnesium that's doing it? Is it the calcium that's doing it? Is it nitric oxide that's doing it? We don't know. You obviously can't give people nitric oxide. You certainly can give people calcium, but you can give them too much. You can also give people too much magnesium. But I know that you do a lot of nutritional counseling, and you're a nutritional neurologist. Most people are magnesium depleted. So once you've optimized the body's needs for magnesium, would you still see a benefit from the magnetic fields? And I would argue that you would. Now, can you enhance the benefits of the QRS beyond saturating tissue with magnesium, getting people up to optimal levels? So I think you're right. I think one of the possibilities may be that we're seeing some of these benefits simply because people are nutritionally depleted or relatively depleted in magnesium. And I don't know what you recommend for magnesium. I normally recommend 400 milligrams a day of supplementation for most people.
Of 100?
400.
Quantron resonance.
Well, the key is getting it into the cells. You have to have an intracellular delivery.
And the magnetic fields do that. They open up the membranes. What they do with calcium is they influence the cell membrane externally, and they open the sodium-dependent calcium channel. Now, I haven't read much about magnesium channels and how the magnesium and calcium channels work together, but you're probably hinting at something important for us to look at.
Well, another aspect is the ATPase that controls the sodium-potassium channel is magnesium-dependent.
All right.
So there were so many factors. It's almost like you have an electronic magnesium effect.
Well, I think the other thing to remember, I mentioned at the outset that what magnetic fields do is they are electromotive. Even in non-cellular systems, you have changes to phosphorylation. So if all you're doing is looking at enzyme kinetics, you will have changes in enzyme kinetics without any magnesium being present. So magnesium is certainly something worth looking at, and we'll have to do that. You and I think, need to have a conversation anyway. I have your number now, and we'll probably have a conversation about what else we can do with this.
Oh, okay.
Thank you. Any other questions or comments?
QuantronResonanceSystems.com.
I have a question. Are you there?
Yes, please.
Is there any studies that have been done to really look at changes in norepinephrine, epinephrine, anything like this to get us a sympathetic response or cortisol after using the pulse magnetic field?
Yeah, I can't remember any specific studies that looked at those levels. What we have been doing, and the QRS will eventually be producing along with or making available along with the QRS a biofeedback system that will look at that tone, and will look at the differences that are caused by it. Those sympathetic sympathetic balance is affected by the QRS. That has been very, very well established.
How did they do that? With heart rate variability?
No, they don't use that approach. They use a plethysmography approach that measures the width and height of the pulse, heart rate pulse. There's specific plethysmographic equipment that tests for that.
Okay.
So we will have that available with the QRS probably next year sometime. It will be an add-on to be able to be used alongside the QRS and help to guide therapy as well.
QuantronResonanceSystems.com.
I have not seen it used along with what you're talking about, the heart rate variability device. We have never seen anybody test it along with that.
That's what I want to do with norepinephrine.
What we do know, some of the research is indicating that the lower fields tend to be more parasympathetic. The lower the field strength, the more of a parasympathetic action you get. Higher field strengths with higher frequencies tend to be more sympathetic, and it causes more of a change in the sympathetic tone. However, we also know that what the body tends to do, if you have a healthy, responsive organism, that what you do is the organism very quickly dampens the signal and brings it back to homeostasis. Where you see the most significant improvements or changes in people who are significantly out of whack with their sympathetic, parasympathetic system. So if somebody tends to have a Raynaud's disease or peripheral vascular disease where their fingers are turning blue with cold exposure, then that is the kind of circumstance where the QRS would be, really significant in the benefit that you would tend to see.
Okay.
In a normal person with normal tone, one way or the other, you're not going to see a relatively normal tone. It's relatively in the middle. You're not going to see much benefit. I think that's a rule with the QRS, and some people get somewhat disappointed with the QRS. They're kind of expecting a miraculous response, and somebody's going to hit them in the middle of the head with a forehand or with a sledgehammer. Aha! The QRS did that to me, and I like it. It doesn't tend to do that. It tends to be used more as a preventative health maintenance system, and may you never know what you've prevented. So we have a dual response with the QRS, one in which